from women and COVID-19 to children. The Health Department says its top priority right now is to have the remaining adult population vaccinated. So this means that those who are under the age of 18 will not be receiving the COVID-19 vaccine soon. Joining us for an explainer is Professor Barry Shube. He's the chair of the Ministerial Advisory Committee on Vaccines. Thank you so much for joining us, Prof. A very important discussion this. Let's talk about why it's important for us to focus first on the adults before we get to the children.
Yes, good morning, Naledi. Yes, I think the important thing really is to kind of look at the adult population for a number of reasons. The kind of main one is really at the bulk of illness, and particularly the bulk of hospitalized illness, people that are admitted to hospital, which really is the main aim which we're trying to reduce with vaccination, is in the adult population. And it goes by age. The older the age, the more vulnerable, the more likely we're going to get more severe disease. So our first priority is to reduce the burden on the healthcare system, and particularly the hospital system, and that goes for adults. Children tolerate this virus very well. When they get infected, it's very rare, very, very uncommon for children to be admitted to hospital. Only then those children which have underlying illnesses. Healthy children, very, very, very few will be so ill that they need hospitalization. So in children, it's really a relatively minor illness. And when we get to the very young children, they not only do they tolerate it well, they don't get very ill, but they also don't transmit very readily. Yeah. So really the priority is adults.
And that's what I wanted. You talk about the transmitting. I think that's an important one to sit on, because many South Africans listening to this discussion right now are concerned around how children transmit COVID-19 and that we should be prioritizing them first, specifically because of that.
No, and the very young children are very poor transmitters. They don't transmit very readily, and there are speculative, it hasn't been proven yet, reasons why this is so. The actual receptors where the virus multiplies hasn't matured in young children, and therefore they are less likely to harbor large amounts of virus in their upper respiratory tract, in their throat and the nose and so on. And therefore they are very much less likely to be actually transmitted. I'm talking about very young children. Obviously, when it gets to adolescents, then they're probably more or less the same as adults. But certainly younger than that, then they are not important in terms of transmitting the virus.
Yeah, but here's the thing, right? In South Africa, we have a very big young population. And so we've set ourselves that herd immunity target of vaccinating 60% of the population. Can we actually do that if we, in the meantime, focus specifically on adults and not include children, considering the massive amounts of vaccine hesitancy that we have in adults?
Yeah, that's a good point. I think when we're looking at the percentage of the population which needs to be immune, we do have to include children, because they may well be a reservoir, maybe a source of virus. But I think the important thing really, I think we look at our priorities. Our first priority is to reduce the amount of serious illness. That's our first priority, because that's really the burden on the healthcare system, the burden on the economy, and so on. That's our first priority. Our second priority is to try and limit the transmission of the virus in the population, what we call herd immunity, that term which is very often bandied about. And exactly what percentage, in fact, is a moving target, because prior to the Delta variant, which is a very transmissible, a very contagious, very infectious virus, we kind of said, okay, we calculated approximately 2/3 of the total population. Now we don't really know, because this Delta is a much more contagious and might well be higher than that. But even if it turns out that COVID turns to be a mild illness, a mild upper respiratory tract, like a common cold, we can tolerate that. I think we're probably going to have to learn to live with this virus, because we can't get rid of it. It's always going to be there. And we need to kind of set the bar at what is going to be tolerable. Yeah. Certainly what is now present is not tolerable.
Yeah, well, let's talk about what we're doing right at this point. 8 million South Africans vaccinated. Is that starting to translate in what we see within our healthcare facilities? A lessened number if we had not vaccinated that many people?
Yeah, I think it may well start being. Of course, that 8 million or 11%, whatever we calculate, whichever denominator, is already starting to kind of have its effect. we've got a long way to go. Clearly, we do. But the rate of vaccination is going pretty well. There had been a slight dip more recently, but we will catch up. We've got good resources of vaccine. And I think you're right. I think it is starting to kind of manifest itself in reduced pressure on the hospitals.
Yeah. Well, thank you so much for speaking to us, Prof. We really do appreciate your time. There is Professor Barry Shube, the chair of the Ministerial Advisory Committee on Vaccines.